Hi. Good afternoon, everyone. I'd like to thank the organizing committee for giving me the opportunity to be part of this grand academic feast, and especially the topic that they provided me. Uh, uh, Working in the city, I'm working very closely with a lot of pediatricians, and as we know, there's a lot of overlap between mental health issues and what we are facing in the current adolescent, or what we say, what they are facing actually, the challenges. So, so the topic which I've been given is about the adverse childhood experiences and how it impacts the adolescent mental health. Just trying to uh, get a bit of a background in terms of the numbers, because numbers also stay with us, correct? We try to make sense of things around us by understanding the things in terms of their prevalence. So globally, around 15% of adolescents between the age of 10 to 19 experience some form of mental health condition or a mental disorder. If we look at Indian statistics, which have been picked up in the last between 2021, 22, nearly 30 to 40% of adolescents, both in urban and rural populations, suffer from depression or depressive symptomatology. A little more than that, suffering from anxiety. As we know, anxiety is very common, is one of the commonest mental health conditions which have been faced. We all face anxiety at some point, but it becomes a disorder if it starts to impact our functioning. Worryingly, suicide is the #1 cause of death in Indians aged between 15 to 29, accounting for nearly 17% of deaths in this age group. And as we see around us, the numbers are growing up. As Dr. Deepika mentioned, even these AI platforms are also misleading. So another challenge for us. And if you look at how COVID-19 shaped as well, which added to it, and as we talk about adverse experiences, I would perhaps put it also as an adverse experience for most of us globally. So adverse childhood experiences, I'm sure all of you are aware of it, are the traumatic events occurring before the age of 18 years, including abuse, neglect, and household dysfunction. It was the term coined by researchers Vincent Felitti, Robert Anda, and the colleagues, which did the seminal study in US between 95 to 97, where they took the questionnaire through adults, looking at their experiences of adverse childhood experiences. And those who suffered from 4 or more of those experiences had impact on their mental health as well as physical health. So when we look at the type of ACEs in the initial study, it was about abuse, which can be emotional abuse, physical and sexual abuse, neglect, emotional and physical neglect, being deprived of emotional connection or warmth by the parent, or physical neglect of not being provided by the basic requirements. Household challenges, living with a parent, caregiver, or another adult who suffers or has substance use, mental illness, suicidal behaviors, divorce, separations, incarcerations, or witnessing domestic violence. As more and more studies have been undertaken on ACEs, further adversities have been added, which go into bullying, community violence, natural disasters, which we see in and around us, refuge situation, or witnessing acts of terrorism. Some of the community ACEs which our children do come across, and it is increasing as well, are bullying, peer rejection or having no friends, racism, and so how does ACE affect the adolescent brain development? What is known is that the ACEs cause the toxic stress, which negatively affects the developing brain. The key areas which we're looking at is the hippocampus, which is primarily for memory, the prefrontal cortex, which is involved in logical thinking, and the amygdala for the emotional processing. Now, over a period of time, as the child's brain is evolving, these changes can lead to difficulties with emotional regulation, learning, and how they manage stress. So amygdala, responsible for processing emotions and detecting threats, can become overactive and enlarged if an individual is continuously getting through stressful situations. So what happens is the person or the child becomes very hypervigilant, they become easily startled, or they're prone to overgeneralized fear, even if the situation may not be that fearful. So the threat may not be so much, but the brain perceives it as threatful, and so as the bodily response to that. The hippocampus, which is crucial for memory formation and contextual memory, in the context of what exactly happened and when happened. So trauma based work the trauma focused work has focused in terms of how the contextual memory gets impacted and its impact in adulthood. It can inhibit the growth of new neurons in the hippocampus and reduce the hippocampal volume, which have been seen in some of the studies conducted in adults who were subject to 4 or more ACEs. The prefrontal cortex, also known as the CEO of the brain, which regulates a lot of executive functions like decision making, problem solving, impulse control, and emotional regulation. So when an individual is going through these toxic stresses, it impacts the development and functioning of the prefrontal cortex, impacting the self-control, the ability to control themselves, being attention, planning, and all. So dysregulated stress response. So chronic stress from ACEs can cause a child's stress response system to become hyperactive, making them quite vulnerable to emotional and psychological distress, and how they perceive it and how that translates into various mental health disorders. So I'll quickly go through this. We're all aware of eustress, the positive stress, which helps us to build the resilience. A tolerable stress response, which is in presence of a supportive environment and an adult which might be there, a supportive or a buffering response, which helps, again, to develop resilience, but does shake us a little bit. And the toxic stress response, which is observed in individuals who have been subject to multiple ACEs, and it has its impact on the brain architecture and the body stress system. What the study has found is the graded effect. So the higher the dose-response relationship, the more the ACEs, the more the impact. We've also seen dysregulated emotionals, a lot of externalizing behaviors like conduct issues, oppositional defiant disorders, personality disorders, borderline personality traits, difficulty in social functioning, adjusting with the peers, cognitive impairment impacting their ability to learn, remember, or focus. So when we get these children from such backgrounds who are subject to all the ACEs or currently going through them, they may come with academic underachievements and their own ability of executive function. And we also see non-suicidal self-injuries or deliberate self-harm behaviors on an increase, leading up to putting them at greater risk of suicide. So anxiety and depression are one of the common mental health conditions seen with impact of ACE. The proportion is higher if there are 4 or more ACEs been subject to that. Within the ACEs, if there's an individual who experiences parental divorce or separation, economic hardship, or witnessing violence within the household or nearby, they are more associated with high rates of depression. PTSD, post-traumatic stress disorder, again, experiencing flashbacks, nightmares, reliving the experiences, emotional numbness, along with symptoms of depression and anxiety. So meta-analysis of 43 studies found that nearly 16% of children exposed to traumatic events developed PTSD, who were subject to the ACEs. The prevalence of complex PTSD is varying, but cumulatively it's around 6%. Complex PTSD is seen in individuals who've been subject to prolonged domestic violence, grievous bodily harm or sexual abuse, or a continuing pathological emotional abuse by caregivers or people who they are surrounded with, which leads to symptoms of PTSD plus symptoms of difficulty in self-organizing, emotional regulation, and for them to form future relationships or substance use disorder across the range. We're seeing new substances now coming up in the market. So along with tobacco, e-cigarettes, vapes nowadays, alcohol, cannabis, and multiple other substances. So the more the ACEs that an individual has gone through, the more they are likely to be experimenting or getting themselves into use of substance as a coping mechanism. Emotional neglect, sexual abuse, physical abuse, or community level violence, they are strong predictors of an individual developing substance use disorder. If we look at the gender variation, girls are more likely to experience emotional abuse and neglect, and they would perhaps demonstrate more internalizing symptoms like anxiety, depression, keeping to themselves, lack of communication, being aloof and all, while boys report higher rates of physical maltreatment and violence, and that translates into more externalizing behavior, antisocial personality traits, conduct disorders. So wide range of adversities. I'm not going to cover all of them, but along with the mental health issues, we also know there can be traumatic injuries and unintended pregnancies, HIV or STDs. Risk of chronic diseases have been proven, including cancer, diabetes, various heart conditions, and its impact on the education. So just highlighting that how in the critical or sensitive developmental period, along with the genetics, because genetics also plays a lot of significant role in mental health conditions and increasing the vulnerability, along with adverse childhood experiences. So let's look at some of the protective factors. Resiliency, a good social support, strong and supportive family environment, a positive school environment, effective coping strategies. All of these have been, just 1 minute, yeah, have been shown to lessen the risk of depression, anxiety, and other mental health problems through various studies. So if the focus goes on developing or focusing on the protective factors, we can even reduce the risk significantly. So how do we do that? What are the interventions? So screening, there are screening tools. The universal ACE screening tools can be used in school or healthcare settings to find at-risk adolescents. Trauma-informed care approaches can be done to individuals or children or adolescents who are going through that in and around them. Therapeutic approaches, trauma-focused cognitive behavior therapy and EMDR, both of them are very much evidence-based therapeutic approaches for this. Building resilience through social emotional learning programs, which can be undertaken at school level. Skill building workshops, which we as healthcare professionals can be part of in imparting that to schools or organizations who work with children, and fostering positive social connection with family and peers, which we can do in family therapy sessions as highlighted earlier. And community engagement, where strengthening the whole system, and that can be quite critical. So just I'd leave it at this. I know I am between everybody and lunch, so yeah.
Yeah,